Ready? All right, well, good morning and welcome to today's briefing. We apologize for being simplest. If you stay home, we want you to stay. Provides you critical daily services, it will remain open. There's also a full list available of businesses that are open. You can go to SpokaneCOVIDresponse.org. That's also a great site for all kinds of COVID-related information. Our plan considers assistance for everyone in our community. Now that includes the unsheltered and those who require a greater level of care and assistance in our community. So today we're announcing two separate plans. Our community is prepared with a plan to expand social distancing in our existing shelters to further slow the spread of COVID locally. And then separately, we have plans that are being finalized to open an alternative care center to accommodate the needs of individuals who may not be able to care for themselves. The two separate these two spaces accomplish two separate objectives: social distancing among our vulnerable, unsheltered population. It also establishes isolation and quarantine space for those who need a place away from their typical housing arrangement. So before I get into any more specifics with these two plans, I'd like to ask Kylie Kingsbury, she's the Homeless Outreach Coordinator with the Spokane Regional Health District, to come and discuss the unique needs of the unsheltered population in our community. Kylie?
Hi, my name is Kylie Kingsbury and I work at Spokane Regional Health District. And I'm happy to be here and to share and advocate for protecting one of the most vulnerable the most vulnerable populations in our community, those who are experiencing homelessness. Often those community members are at high risk for having complications of COVID-19 and experiencing severe symptoms. Often that's because they have underlying health conditions and chronic health conditions as well. Another reason why community members who are experiencing homelessness are extra vulnerable in this time are that they have limited access to healthcare services, limited transportation to those healthcare services. They often have trouble paying for copays, insurance. It is also limited on hygiene, so there's not a lot of places necessarily to wash your hands or to keep up on that. It's really important that at this time we ensure that this population is able to social distance just like the rest of our community. And so we're working really hard with homeless service providers and homeless shelters to allow community members to follow those same guidelines in the facilities. And so part of that is having the shelter beds at least 6 feet apart. So when community members are staying there, they're following those social distancing guidelines. Because of that, there's limited space in the shelters, and so that's why it's really important that we are offering the space for emergency shelter beds at the library.
Thank you, Kylie, for that. Kylie will be on hand too for questions after our briefing. So again, we are meeting two separate plans. So let's go over those. First, a need to accommodate social distancing within our shelters, and then separately, we want to make sure you understand that separately, a facility to care for those in our community who might not be able to care for themselves. So taking those plans separately, let's start with the shelter expansion part of it. Plans to expand shelter spacing capacity in the downtown library, we believe will be operational early next week. The step is being taken with our regional partners in the interest of community health and also to slow the spread of the COVID illness. The downtown library, which is being prepared for renovation, as many of you know, will expand the physical space to accomplish social distancing during this health emergency. It has been designated to accommodate new spacing needs within existing contract shelter facilities to comply with social distancing requirements. So this will be for healthy populations, only with no commingling of programs. This is an initial phase while we understand in greater detail the full extent of the need. Our regional partners are also discussing potential additional expansion of the physical shelter space should the need arise we will be working on that as well. So state emergency funding allocated through the Department of Commerce is going to cover the cost of the shelter space expansion. Separately, our regional partners are working on a plan to establish an alternative care facility that would be at the Spokane County Fairgrounds. Details are still being worked out on that, but the intent of that location would be to establish a place for anyone who may not be able to care for themselves to receive care. Additional information about that space could come as early as next week, so stay tuned here each day for an update on that. That concludes our comments now, but we are available for any questions if anybody has them.
We do have a question, whoever you think would be the best one to answer this. We were asked if you could expand on why the downtown Spokane Library was opened and the purpose behind that. We could bring Tisha Danzig from the City of Spokane. She works with our CHHS department, and she is very involved in that. So Tisha.
Thank you for the question. The reason the downtown library for expansion for our shelters is really to help redistribute, address social distancing in our shelters. So the downtown library allows us to alleviate some of that overcrowding at the existing shelters, bring folks into that space and provide really great care for them in that shelter setting. So the downtown library, because it is available for us right now, has really great opportunities for different spacing and to be able to meet those public health recommendations.
Another question we had is what's being done to contact some of the more vulnerable in our community here?
So I can speak to the vulnerable community members that are experiencing homelessness. We've been working really closely with our outreach teams. These are professionals that work with our unsheltered population frequently to address those needs. We're looking at guidance from CDC, from the World Health Organization, and from our partners in King County and around the country that are trying to address the unsheltered population specifically. Leveraging those communication strategies to be able to give them the best information that we can about COVID-19.
And just so we can be very, very clear, can we differentiate whoever would be the best person to speak on this? Again, the difference between the downtown Spokane Library site and the fairground site.
Sure. You want me to go ahead and do that? So, again, two separate things that we're talking about. The first one, the downtown Spokane Library site, is an overflow site for the shelters that are already existing for our homeless population so that we can provide more beds for them as we implement social distancing measures. The fairgrounds, which is still being worked on, is a separate plan. That's an alternative care facility, and that is for people who might need isolation or quarantine, but they can't do that themselves. They can't go home. They need another place to care for themselves. So I hope that's clear.
It does. And the final question, why is this so important?
The facilities?
The facilities
Well,
and to our community.
Well, we have to protect our community. This is about public safety. This is about a healthy community, and we have to provide space for our very vulnerable population. And as we've seen other cities do too, we have to provide a space for people who need care but can't go home for that care. They need to be quarantined. They need to be isolated from the rest of the community. This is all being done to slow the spread of COVID and to keep that curve as flat as possible. And these are measures that we've seen other cities do, and it's quite impactful. So we are being proactive so that we have those facilities in place when we need them.
I know we said this was the final question, but we do have one more here. Does the city expect all shelter operators citywide to stay open 24/7? And if so, will it provide any additional funding for these shelters? How would they handle the increased need for staffing?
I'll let Tisha answer that because I know a lot of people have asked because of Governor Inslee's Stay Home, Stay Healthy order, what does that mean to our shelters and transitioning into a 24/7 possible model. So I'll have Tisha talk about that.
Yes, we are encouraging our shelters to move to 24/7 in order to meet the Stay Home, Stay Healthy order from the governor. What that looks like for our partners is we've been reaching out around the clock, trying to find out what kinds of resources they need in order to do that, working with meal sites to help bring food to those shelters so that everyone gets a nutritious meal 3 times a day, finding out what other sanitation and hygiene needs that they have so that we can help them fulfill that request, because we do want to maintain very healthy and safe places for folks 24 hours a day in the shelter system. So we do anticipate providing additional resources to all of those shelters that are moving from night by night to 24/7. Thank you.
All right, thank you, Tisha and Kylie. That's our last question for today's briefing. We thank you.